equals 0.1 to enter into my final model. And then I retained those that had a significance of less than 0.05. I also examined the variables for interactions. And one thing that I did for when I was looking at whether the priority ranking had any association with the number of times the topic appeared in the literature, I considered a Poisson regression and a negative binomial regression for analysis using the AIC. And I chose the one with the smaller AIC. So I had 319 publications in all that were categorized into 20 different topics. 56 had a first author that were affiliated with the Center for Global Nursing. And when I say that, what I'm talking about is some nursing schools have a specific global center where they're trying to do outreach. So it could be that they're sending their students to other countries, or that they have some kind of networks of collaborations with other countries. So it's not necessarily the same as an international affiliation, because an author could independently have some international affiliations but not be affiliated with the Global Nursing Center. And then this WHOCC is a World Health Organization collaborating center. So 70 of the first authors had an affiliation with the WHOCC. And you can see that 62% of them had a PhD degree. So the first aim was to see whether there was an association between the priority ranking by the experts and the number of times the topic appeared in the literature. And I ended up using the Poisson regression based on my analysis. My outcome was the number of times the topic appeared in the literature. And then my predictor variables that I considered for the model were the priority ranking by the experts, whether they had a major funding source for that research topic, international affiliations or nursing affiliation of the first author, a first author affiliated with the World Health Organization Collaborating Center, the Global Nursing Center, or the country of the research. And this is the final model that I ended up with. So you can see here that a critical ranking compared to not a priority was associated with appearing fewer times in the literature. And this indicates, so an incident rate ratio of 0.388 indicates that there was a 61% reduction of the publications for topics that were ranked as a critical priority compared to those that were ranked as not a priority. And also for important, it's kind of the opposite effect. There's a 63% increase in the number of publications for a topic that was rated as an important research priority. And together these suggest that there could be a misalignment between what the nursing researchers consider to be a priority for the region and what is actually being researched. First author with international affiliations was also significant, having a 19% increase for every additional first author with an international affiliation. And this is actually not too surprising. There's other studies that show that there's an increase in publications when the author has an international affiliation, and perhaps this could be related to increased pressure from your international collaborators. And a first author with affiliation to a global nursing center, again, had a reduced incident rate ratio. So the number of publications on the topic decreased by 26% when the first author had an affiliation with the Global Center for Nursing. And we hypothesized that this could be because they were perhaps focused on other kinds of research other than clinical research, or perhaps less focused on research in general and maybe more on generating collaborations or networks or student clinical sites or something of that nature. The second aim was to look at the association between priority ranking and publication in the gray versus the index literature. And for this, because the outcome variable was categorical, having two categories, either index or gray literature. We used a logistic regression, and we considered many of the same variables and a couple of others, such as the education level of the researcher and the year. So the results for this were that a topic that was ranked as an important priority was 2.94 times more likely to appear in the gray literature than the index literature. And if it was ranked as a critical priority, it was almost 20 times more likely to appear in the gray literature. And together, these suggest that although nurses are doing research that's critical to the area, they're having a difficult time getting it published in the index literature where it's easily disseminated. We also found that for those researchers that had a doctoral degree compared to a bachelor's, they were almost 5 times more likely to appear in the gray literature. And likewise, master's degree researchers were almost 6 times more likely to appear in the gray literature. And we have found from our collaborators that publishing is a requirement for graduation, so this could explain some of the difference. Also, there's research from other fields of science that show that junior scientists or junior faculty have a harder time getting publications out. And we think that this could be related to a lack of support or mentorship or experience in trying to publish. And then the last thing that was significant was the major funding. So for those topics with major funding, they were 83% less likely to appear in the gray literature. And it makes sense because if your topic had not enough funding, the quality of your research may not be that great, and you may have trouble getting it published in an index source. So the third aim, and it's almost over, is I looked at temporal trends in publication output. And I did this through a couple of things. The first was the average annual percentage change, looking at it both on an annual basis and in a 5-year increment, and the percent relative growth. So the dotted blue line here is the absolute number of publications per year, and then the red line is the average annual percentage change. And you can see that it's not necessarily always going up, but if you look at the overall trend, comparing the 5-year periods, there was 175% increase annual average percentage change. And the percent relative growth for the whole period was 115%. So we see that nursing research is increasing from African countries. So to discuss this, what we gained from it is that clinical nursing and midwifery research in southern and eastern African countries may not be driven by what research experts in the region consider to be of critical importance. Furthermore, lack of mentorship or support for emerging scientists may thwart their efforts to get their research published. And one way that we suggest could help is to implement a collaborative network or more mentorship type of programs for emerging PhD scholars. And this publication is also under review. And again, this is the 3 aims were identified. Aim 1 was the information source, aim 2 was the transmitter and the message, and then the third aim was looking at the noise source for the resources of the area. Overall discussion is that, as we all know, nurses are ideally positioned to make a big impact on clinical research. But if they're not doing the research on what's important locally, then their efforts are undermined. And it will be hard to improve health outcomes if we don't have a strong foundation for an evidence-based practice. And we also suggest that we should implement perhaps collaborative networks or mentorship strategies for emerging scholars. And we suggest that policymakers and funders, both within and without within the region and outside the area, look at what the nurses in the area say are the critical research priorities. And this is an important step in reducing waste in research. I'd like to acknowledge everyone that helped me, especially Dr. Larson, my advisor. Dr. Dorn couldn't be here, but she's the head of the Office of Global Initiatives and did a lot for this. This is her with Audrey and Grace, our collaborators in Africa. This is Dr. Klopper, who's on the phone. This is Yuhei and I setting up the conference in Africa. This is Kenrick, the resident photographer at the conference. And Dr. Larson and I graduating. I hope that's a good sign. And I'd like to thank my committee members, Dr. Nicholas, Dr. Ja, Dr. Bhakti, and all of my other many faculty and staff that have helped me, as well as my classmates, my cohort, and I appreciate everyone. And last but not least, thank you to my husband and my mom and dad and my sister and my daughters who aren't here, but I thank everyone for all of your support.